Madame la Présidente, Mesdames et Messieurs les Présidents, Mesdames et Messieurs les maires et maires adjoints et représentants des municipalités, chers collègues, Mesdames et Messieurs, je suis très honoré de vous accueillir ici en tant que représentant de l'exécutif de la ville de Genève au palais Jean-Gabriel et Anna Hénard, dans ce lieu qui a une longue histoire, puisqu'il a été inauguré il y a 100 ans et a connu de très nombreuses affectations avant de devenir le siège de l'administration municipale. Et nous nous réjouissons de le mettre à disposition pour des hôtes de marque et des événements importants, comme aujourd'hui, surtout que les derniers temps, il n'y en a pas eu beaucoup. Donc bienvenue à celles et ceux qui sont physiquement présents, mais bien sûr aussi celles et ceux qui nous suivent virtuellement. Dans un monde idéal, nous aurions été toutes et tous ensemble ici, mais les conditions sanitaires sont toujours compliquées. Toutefois, et je remercie beaucoup la Commission globale de politique en matière de drogue d'avoir décidé d'aller de l'avant, parce que l'enjeu est tout à fait fondamental, et donc c'était bien de maintenir cet événement au mois de juin. Bien sûr, les derniers mois, nous avons surtout parlé de coronavirus en matière de santé publique et de tous ses impacts. La crise n'est pas terminée, les impacts sont encore très importants et vont durer. Mais nous ne pouvons pas nous permettre de délaisser les autres problématiques de santé publique. Et au moins le maintien de cet événement en forme hybride va nous permettre d'échanger aujourd'hui et atteindre les objectifs que nous nous sommes fixés ensemble. C'est donc une opération conjointe à l'initiative de la Commission globale de politique en matière de drogue avec la ville de Zurich et ma collègue Corinne Maur, présidente de la ville de Zurich, va prendre la parole dans quelques instants, et la ville de Genève que nous vous accueillons et nous réjouissons que vous ayez donné suite à cette invitation. Les maires et plus largement les gouvernements locaux, nous sommes le niveau institutionnel le plus proche de nos concitoyens et concitoyennes. Nous avons une connaissance de la réalité de terrain, nous sommes en contact fréquent avec la population. Bien sûr, nous appliquons des décisions et des directives, des lois qui sont définis en général au-dessus de nous, les niveaux institutionnels supérieurs, souvent au niveau national, voire international. Mais nous sommes en première ligne pour collecter les observations, analyser les effets et des conséquences et interagir concrètement avec les acteurs sociaux de nos villes. En ce qui concerne les politiques en matière de drogue, les villes, évidemment, sont un des pivots essentiels à l'élaboration et à la mise en application de mesures concrètes. Même si certaines lois sont, comme je l'ai dit, définies plus haut, la réalité de terrain nous concerne directement. Chaque situation peut différer quelque peu d'une ville à l'autre, liée à notre taille, notre histoire, la marge de manœuvre légale, la volonté politique, la configuration. Mais nous avons des points communs et l'échange que nous allons avoir aujourd'hui n'en sera que plus intéressant et devrait nous permettre de déterminer une ligne commune en la matière. Je suis évidemment très heureux que cet échange soit ancré à Genève, soit porté depuis ici. D'une part, parce que l'engagement de Genève sur cette thématique est ancien. Il est riche, il a souvent été offensif, créatif, novateur, parfois provocateur. Si on se rappelle par exemple de l'époque où le VIH, le sida faisait des ravages et que Genève a osé prendre des décisions très courageuses, dans un cadre suisse également très offensif et courageux, cela mérite d'être rappelé. Mais je suis également heureux que cet échange puisse être mené depuis ici à Genève, parce que nous avons cette dimension internationale qui accueille de très nombreuses organisations gouvernementales et non gouvernementales, à commencer bien sûr par l'Organisation mondiale de la santé. C'est un lieu de dialogue, de discussion, d'échange, parfois controversé, mais c'est important que ce dialogue ait lieu. C'est parfois aussi un lieu de négociation de normes communes, et aussi dans ce sens-là, c'est fondamental. Ces échanges peuvent porter sur plein de sujets différents. Le désarmement dans le monde, l'enjeu des réfugiés, les enjeux du numérique, la défense de l'environnement ou du climat, le commerce international et bien sûr les politiques en matière de santé publique et donc aussi de drogue. C'est une responsabilité que nous avons à Genève, que nous sommes fiers d'assumer et nous faisons de notre mieux pour que ça se passe de manière aussi riche et constructive que possible. J'aimerais évidemment remercier très cordialement les personnes qui sont impliquées dans cet événement, et notamment Mme Ruth Dreyfus, à ma droite, ancienne présidente de la Confédération suisse, et Corinne Maur, maire de Zurich, ainsi que l'ensemble des équipes. Et merci à toutes et tous de participer activement à cet échange, car nous avons besoin de l'intelligence collective pour avancer concrètement ensemble. Merci de votre attention. Et j'ai le grand plaisir de passer la parole à ma collègue Corinne Maur, maire de la ville de Zurich.
Merci beaucoup, Sami Canaan. Dear Sami Canaan, dear Ruth Reifus, dear mayors, dear representatives of the city governments worldwide, dear participants from Switzerland and from all over the world. Together with Sami Canaan from the city of Geneva and with Ruth Reifus from the Global Commission on Drug Policy, I am very happy to welcome you to this conference. Our aim with this international exchange is to create a place to discuss with representatives of different international cities an important and a relevant issue, drug policies in cities. This event is co-hosted by the City of Geneva, the City of Zurich, and the Global Commission on Drug Policy. On a small scale, this event is an example of fruitful cooperation and of multiplying our impact when we work together. We can only tackle global challenges together, working together, learning from each other, inspiring each other. Our strong belief in cooperation is the reason why we are meeting both virtually and in real life today. Nowadays, it is hard to imagine that Zurich used to be known internationally, not only for its strong financial sector, for its picturesque lakeside, and for its outstanding quality of life, but for its large open drug scene. Many of you might remember the term Needle Park, which was the name of the large open drug scene in the city center during the 1980s and the early 1990s. At times, several thousand addicts were using and dealing drugs in the park. The conditions were very unhygienic. Many got infected with diseases such as HIV or hepatitis. The crime rate was high. Hundreds of addicts died. During this time, it became clear to the representatives of our city that they would not be able to address the situation in a sustainable way with repressive measures only. This understanding led to a rethinking of drug policy. New measures to reduce harm were implemented in the early 1990s. For example, contact and drop-in centers for addicts were established, where drug addicts could consume substances under hygienic conditions. Furthermore, emergency sleeping facilities were created and work integration projects started. The voters of Zurich supported this new drug policy. They voted for social assistance measures for drug addicts. These measures marked the beginning of the so-called four-pillar drug policy. The four pillars being prevention, repression, assistance, and treatment. A combination of measures aims to prevent people from developing a substance dependence in the first place, but also to help them recover and to reintegrate into society in a sustainable way. Regulatory measures focus on law enforcement and on dealing and trafficking of illegal substances. In the 1990s, the four-pillar policy was a pioneering act. By now, it has proven its worth and it is widely supported. It has been introduced throughout Switzerland and it has been copied and used as an inspiration for drug policies in many other countries. This example shows how city authorities can take a role of leadership. By implementing suitable drug policies, they can bring about sustainable changes of the situation. We are here today because as city government representatives, we can take a leading role in inspiring change and reform. Together, we can aim at designing better and more efficient drug policies that focus on the health and safety of our citizens. I would like to thank very much the City of Geneva and the Global Commission on Drug Policy for the initiative to organize this important event that the City of Zurich is co-hosting. And thank you to all of you who are participating in this meaningful exchange and shaping effective drug policies in cities. Thank you very much for your attention, and I would like now to forward the word to Ruth Dreyfus. Thank you very much.
Mesdames et messieurs, au nom de la Commission globale de politique en matière de drogue, je vous souhaite à mon tour la bienvenue et suis très heureuse de le faire en compagnie de Madame Maurer et de Monsieur Cannon. Mais je le fais aussi en tant qu'ancien membre du gouvernement de la Suisse, responsable pendant 10 ans de la santé publique et de l'application, puis de la réforme de la loi suisse sur les stupéfiants. À ce titre, je suis bien placée pour mettre en évidence le rôle des municipalités, et à Genève d'ailleurs le rôle du canton, dans l'expérimentation de solutions plus adéquates des problèmes que cause la présence des drogues aux habitants de nos villes et agglomérations. Ce sont les autorités locales qui ont exploité toutes les possibilités d'une loi surannée, allant même parfois au-delà de ce qu'elle autorisait et provoquant ainsi la révision. Elles ont écouté les personnes concernées dans le voisinage des scènes de deal et de consommation, mais elles ont aussi écouté les consommatrices et consommateurs de substances illégales, les membres des associations et des services publics qui travaillaient au plus près des populations impactées par les conséquences sanitaires et sécuritaires. C'est en effet à ce niveau politique, le plus proche des habitants et des habitantes, que la confiance entre celles-ci et les autorités est la plus aisée à établir, à rétablir et à consolider. Vous avez entendu les expériences de Zurich et de Genève, et nous aurons le privilège tout au long de notre rencontre d'entendre d'autres exemples. C'est la seconde fois que la Commission globale réunit des maires et bénéficie de l'appui de Habitat, d'experts et d'une représentante des personnes qui consomment des drogues illégales. Cet échange d'expériences contribuera, j'en suis certaine, à nous encourager les uns et les autres sur la voie des réformes, à démontrer que malgré les contraintes inhérentes aux lois nationales et aux conventions internationales en la matière, il y a des marges de manœuvre à utiliser. Il y a des risques à prendre aussi pour assumer les responsabilités des autorités locales envers leur population, responsabilité du vivre ensemble, responsabilité envers les plus vulnérables, responsabilité de qualité de vie pour toutes et pour tous. Les contraintes législatives auxquelles les autorités locales ont été confrontées se sont atténuées au cours des dernières années. La complexité des problèmes liés aux drogues a été reconnue en même temps que l'échec et les conséquences négatives des réponses reposant uniquement sur la répression et sur l'illusion d'une société sans drogue. En 2016, la session extraordinaire de l'Assemblée générale des Nations unies sur les drogues a adopté un document final qui réoriente le contrôle des drogues vers des politiques plus équilibrées et souligne d'ailleurs le rôle que les villes y jouent. Et en 2019, le système des Nations unies a adopté une position commune sur les questions de politique en matière de drogue qui est commune à toutes les agences et les institutions de la famille des Nations unies. Dans les deux cas, le plus important est que des sujets jusqu'alors tabous ont été mis en évidence, comme l'efficacité des mesures de réduction des risques, l'élargissement des offres de traitement et la condamnation des traitements sous contrainte, la promotion d'une répression plus ciblée vers les organisations criminelles et la nécessité de réduire la population carcérale de consommateurs et de consommatrices et de petits délinquants non violents. On a aussi mis en évidence les conséquences néfastes en termes de développement pour les populations qui participent à la production et au transfert des drogues. La priorité donnée au respect des droits humains et à la santé publique a été affirmée, ainsi que la nécessité de décloisonner la politique en matière de drogue pour tenir compte de tous ces aspects. Ces prises de conscience offrent aux villes de nouvelles opportunités d'agir. Et cela est d'autant plus important que ce sont elles et leurs populations qui subissent les conséquences de politiques erronées décidées au niveau national et international. Sur le plan de la santé, si l'on pense au rôle que joue la drogue dans la diffusion de maladies transmissibles, le sida, l'hépatite, la tuberculose, les deux personnes qui viennent de parler y ont également fait allusion. Mais aussi sur le plan social, par la marginalisation de populations stigmatisées, et sur le plan de la sécurité, alors que le crime organisé domine certains quartiers et suscite une violence entre gangs et entre eux et la police, voire même les forces militaires, ce qu'on a appelé la fameuse guerre aux drogues, avec ses dommages collatéraux au sein de la population. Aider les villes à faire face à ces problèmes, en favorisant les échanges d'expériences positives, en analysant leur potentiel à développer des stratégies coordonnées, est un des objectifs poursuivis par la Commission globale. C'est le but de cette rencontre et c'est le contenu du rapport que nous sommes en train de publier, Politique de drogue, villes et municipalités. Dans ce rapport, nous encourageons les villes à offrir un large éventail de mesures de réduction des risques et à ne pas hésiter à mettre en place ces services dont l'efficacité n'est plus à démontrer, mais qui rencontrent encore des résistances non justifiées. Nous demandons également aux maires, aux autorités locales, de donner pour instruction à leur police municipale de mettre fin au harcèlement des personnes consommatrices de drogue qui ne portent pas préjudice à autrui. La peur de l'arrestation et la crainte des violences ne doivent plus empêcher les personnes souffrant de dépendance aux drogues d'accéder aux services auxquels elles doivent pouvoir prétendre, notamment aux services de santé, au logement et aux services sociaux. Nous soulignons aussi le besoin que les politiques locales soient cohérentes et surtout qu'elles offrent une plateforme permettant la participation de toutes les personnes concernées, à la fois toutes les communautés impactées d'une part et tous les intervenants publics et privés qui luttent contre les conséquences négatives de la présence des drogues dans la société. Et enfin, nous encourageons les autorités locales, communales, les maires, à envisager d'expérimenter la régulation légale des drogues échangées actuellement de manière illégale sur leur territoire urbain. Bien sûr que les lois peuvent le rendre difficile, mais des projets pilotes peuvent se mettre en place, par exemple pour la régulation du cannabis ou par exemple pour la création de traitements de substitution qui sont une façon d'utiliser en fait des substances contrôlées pour leur utilisation médicale. De tels projets pilotes soumis à une évaluation scientifique sérieuse permettent d'informer la population et d'informer les autorités de niveau supérieur des alternatives au recours à la répression pour contrôler les drogues en milieu urbain. Bien sûr, nous, de la Commission globale, nous n'abandonnons pas l'idée de modifier les lois nationales et d'influencer également les conventions internationales qui actuellement créent comme une restriction aux innovations. Mais c'est par en bas que les choses se passent, c'est en bas que les expériences se font, c'est dans les villes et les communes que, dans le domaine des drogues, l'inspiration nous vient, et c'est de cette possibilité pour les villes d'informer, de modifier le cadre général que nous allons aussi avoir l'occasion de parler. Merci.
Merci beaucoup, Ruud Dreyfus, pour ce message très fort. Je profite pour saluer la présence à ma gauche de Peter Feldman, maire de Francfort. Willkommen in Genf. Et puis d'abord vous annoncer, avant de passer aux échanges et au panel, un message de Madame Maïmouna Moucharif, qui est directrice exécutive d'ONU Habitat, donc un des programmes importants des Nations Unies qui s'occupe d'habitat urbain, et par conséquent se sent très concernée par ces problématiques. Madame Moucharif ne pouvait pas être physiquement avec nous, mais elle nous fait l'amabilité de nous adresser un message. Merci.
Excellencies, distinguished mayors, colleagues, friends, ladies and gentlemen, I wish to convey my most sincere appreciation and pleasure to be part of this international meeting on drug policies and cities governments. It comes at a time when the circulation of illegal drugs worldwide has led to the increase of crime and violence and the feelings of generalized fear among inhabitants in cities and towns, creating a climate that threatens the democratic foundation of cities and countries. This perception of insecurity has resulted in the abandonment of certain neighborhoods in many cities and towns, the development of an architecture of fear, the stigmatization of districts or communities, and the withdrawal or refusal to invest in some cities. The war on drugs and crime requires multi-sectoral and comprehensive policies at city level that configure security co-production modalities with a strongly preventive approach and no one-size-fits-all solutions. The 2030 Agenda for Sustainable Development and the New Urban Agenda have put people, health, and human rights at the center of sustainable development. Goal 11, in particular, positions cities as the sites where the impact of the drug and safety problem is most vivid, and at the same time, where the response thereto on development solutions can be observed at the individual, family, and community levels. Hence, without safety, there is no sustainable urban development, and likewise, without sustainable urban development, there is no safety. Cities can now leverage on city-to-city cooperation to address the drug problem and create the capacity for local engineering to solve drug prevention problems. In this endeavor, we welcome cities present here today to join our global network on safer cities in the peer review process to exchange best practices and share their expertise on making cities safer and inclusive. Each city's drug prevention policies can progress on the basis of positive experiences as well as failures experienced up to the present. Today, I would like to share with you 3 key messages. 1. On the role of the United Nations, the Chief Executive Board, or CEB, has endorsed a UN system common position and shared policy on supporting the implementation of the international drug control policy through effective interagency collaboration. In this endeavor, UN Habitat has established a joint program framework with UNODC, which will support cities in adopting the SDGs and the New Urban Agenda as reference frameworks to guide their policies and plans towards safer cities. It is my recommendation that this meeting explores avenues of concrete and measurable technical cooperation between the UN and cities to address this drug problem and further considers a financial resource mobilization plan to accompany such a cooperation framework for cities to the year 2030. My second point is on the roles of cities in relation to urban drug policy, public safety, and health. Cities, as the level of government closest to the people, have had a history of innovation in prevention policies on crime and drugs, demonstrated by, among others, the 25 years of work of UN Habitat Safer Cities program. Evidence from UN Habitat's practice is affirmed by member states at the first UN Habitat Assembly in May 2019 in Nairobi, Kenya, that adopted UN system-wide guidelines on safer cities and human settlements. We urge cities to fully take advantage of these guidelines to progressively shift the local political and institutional cultures from a reactionary approach to drug and public insecurity to one that allows for the co-production of safety for all by tackling the causes of drug abuse and insecurity in our cities and human settlements. Indeed, making drug prevention programs a key component of better urban governance. It is for this reason that my third message is reiteration of my commitment to a safer, inclusive, resilient, and sustainable cities and human settlements. Cities can turn the COVID-19 crisis into an opportunity to build back better and greener by drawing on the lessons from practice on how the pandemic and its control measures has impacted on drug prevention and control initiative. UN Habitat will take the opportunity of this significant platform to partner with you in promoting the role of cities to enhance urban drug policies, public safety, and health agenda in the COVID-19 social recovery phase. I would like to close with sincere congratulations to the organizers of this meeting and invite you to further consider promoting this dialogue at the 11th session of the World Urban Forum, which will take place in Katowice, Poland next year. Thank you.
Merci beaucoup pour le message de Madame Maud Sharif, directrice exécutive de ONU Habitat, qui a été elle-même d'ailleurs maire de l'île de Penang, en l'occurrence en Malaisie, donc qui connaît aussi très bien la réalité locale et qui est très sensible au rôle des villes et des gouvernements locaux en général. J'ai maintenant le plaisir d'ouvrir la partie des échanges avec, comme vous l'avez vu dans le programme, nous aurons 2 sessions d'échanges avec des panels et ensuite bien sûr la possibilité d'intervenir pour le public. Et le premier panel sera animé par M. Pavel Bem, ancien maire de Prague et membre de la commission globale, avec la participation de Josefina Belmonte, maire de Quezon, Peter Feldman, qui est à ma gauche, maire de Francfort, Kostas Bakoyannis, qui est maire d'Athènes, et José Zuniga, président de EAPAC et des Fast Track Cities. Et j'ai le plaisir de passer la parole à Pavel Bem. Merci.
Madam President, distinguished mayors, city representatives, colleagues, friends, it's my honor to chair and moderate the session number 1 on challenges and opportunities cities have to influence drug policies and priorities according to local context and needs. Best regards from the historical city of Prague. As we have heard from the keynote speeches and introductions, international and national level drug policies have not been able to reduce the illegal drug markets in cities, but in addition, they have created and supported other unintended negative consequences. Some of them are disastrous for both public health as well as public safety. As a former drug czar of the Czech Republic and later as a mayor of Prague, I had the chance to challenge drug policy reform at both levels, the local as well as the national one. I have to conclude that facing these human, social, and economic harms related to prohibitive drug policies, city governments and personally mayors have full humanistic right and maybe even a duty to introduce inevitable drug policy reforms. Today, innovation is happening in cities all over the world, not only in high-income countries, but increasingly in program and initiatives led by municipal bodies in Latin America and Caribbean and North and Sub-Saharan Africa, in Australia. We, the members of the Global Commission on Drug Policy, know that cities have a pivotal role to play even if punitive drug laws, I mean at the national level, are adopted. I have the honor today to chair this panel with three incumbent mayors of three major cities, and with Dr. Zuniga from the Fast Track Cities Initiative to discuss challenges and opportunities resulting from these policies. The question is how they have to adapt their responses to mitigate the social, health, and economic harms. So allow me to introduce and give the floor to Joy Belmonte, Mayor of Quezon City, the most populous city in the country, where the focus on repressive drug policies has been absolutely unprecedented. The city focuses its efforts on prevention and education and on mitigating the social aspects of the war on drugs. Joy Belmonte, the Mayor of Quezon City, the floor is yours. Welcome.
Thank you very much, Mayor Pavel. Good evening, ladies and gentlemen, to my fellow mayors and to all the other panelists. This evening, I would like to share one of the more recent programs of our city to address the challenge of increasing drug offenses among women. And it is a program called No Woman Left Behind. This program was conceived in my capacity as a women's rights advocate, as well as in support of my role as the chairman of the city's Anti-Illegal Drugs Council. While this is primarily a program to promote gender equality, it is relevant to the context of our discussion because it centers around persons deprived of liberty, or PDLs, that are currently detained in our female correctional. Of note is the fact that 92% of the women in this facility, or 624 of them, are incarcerated due to drug-related offenses. The majority of them are women between the ages of 26 and 30 years old. 26% are repeat offenders and 61% are single mothers with very little education. The drug-related offenses for which they are imprisoned include the possession of drugs, the use of drugs, or both, the sale, trade, administration, dispensation, and delivery of drugs, and possession of equipment, instruments, apparatus, and other paraphernalia needed for drug use. A general profile of our female PDLs indicate that a majority of them live in slums and other blighted areas in our city of more than 3.1 million people. It is therefore safe to assume that for many of them, poverty was the main reason they were driven to be involved in illegal drugs. As the wheels of justice are extremely slow in our country, it is possible for these women to be detained for years before they even go to a single hearing. This seems extremely harsh when coupled with the fact that some of these offenses seem light, like possession of very small amounts, or those that require other interventions, such as drug use, which would seem to be better addressed in a rehabilitation facility rather than in a jail. Yet the Comprehensive Dangerous Drugs Act, which is the primary legal tool pertaining to the issue of drugs in our country, has remained unchanged for more than 20 years. Fortunately, one of the interim interventions introduced as part of the national government's program, while amendments to the Dangerous Drugs Act are being awaited, is plea bargaining. Under this system, offenses such as drug use and possession of dangerous drugs can be imposed lighter penalties, such as an intensive outpatient program consisting of 24 counseling sessions, or inpatient rehabilitation and treatment inside our facility for a minimum of 6 months. Despite this, however, the women in our correctional facility need a holistic program if they are to be given opportunities to pursue second chances at life. Thus, last March 8th, which coincides with International Women's Day, our City Council passed an ordinance institutionalizing a comprehensive program for persons deprived of liberty at the Quezon City Jail Female Dormitory, This is what we call the Women's Correctional. The objective of this legislation is to provide the necessary services and intervention programs to ensure that our persons deprived of liberty are empowered for them to eventually become self-reliant when they are released from the facility, thereby reducing recidivism. Moreover, their overall well-being is also of primordial concern in this program, including the physical, mental, and psychosocial well-being of our clients. To date, our program includes high school, college, and technical vocational education to eventually help them pursue decent employment upon their release. An office of the city government is assigned to help match them with potential employers. For those who no longer want to study, skills are taught to them to enable them to earn a livelihood. They are mentored to put up micro businesses, and we provide them with financial assistance as well as assistance to market their products through the private sector. To help them cope with the circumstances they are in, we provide them with life skills and mental health care services, which can include counseling, psychological assessment, and medication if necessary. Physical health care services are also regularly provided to help for them for early interventions should the symptoms of disease be detected, most particularly diseases that are unique to women. Medicines are also readily available to them through this program. To conclude, we hope that this holistic approach to women empowerment will result in ensuring that our persons deprived of liberty that have been incarcerated, most especially due to drug-related actions and driven predominantly by extreme poverty, will find opportunities that will release them from the bondage of dangerous drugs and towards brighter futures upon their release. Thank you very much, and that is the experience of Quezon City.
Thank you very much, Joy. Now we can continue, and I have a great honor to have Peter Feldman, the mayor of Frankfurt, with us. Frankfurt, along with Bern, Zurich, and Hamburg, was one of the 4 cities that have introduced harm reduction services starting late 1980s and have shown the way of local responses to problematic drug use, mainly to face HIV transmission and overdose deaths during the epidemics. Frankly speaking, in the capacity of the Lord Mayor of Prague, as well as the national or Czech drug czar, I obviously was looking at Frankfurt as to older and more experienced sister or brother of the city of Prague. And until now, I see the city of Frankfurt looking at the harm reduction strategies introduced as a tutor or a teacher for most of us. So Peter Feldman, the floor is yours, please.
Thank you for the very nice and polite introduction. It's a big honor to speak to you, the audience of this conference, and the audience also on the electronic devices to share in time of the pandemic knowledge and experience. For us, it's a very important topic, and it's makes me happy to speak to this topic because I'm persuaded that communal solutions in drug policy is a relevant advantage not only for the communes but also for the national area. So we need a lot of room to share and to our experience, and also to talk about what will the continuation of our policy on the local sector. I will change over to Germany because it's much more easy to share the things, and you will translate it, I think, very fluently, as I understood from the translation from other languages to German. Der internationale Erfahrungsaustausch fördert die Weiterentwicklung auch der eigenen Strategien. Städte wie Genf, Zürich, Bern, wir haben es eben gehört, gelernt, und auch Frankfurt waren Vorreiter mit guten gemeinsamen Ansätzen, die auch abgestimmt waren. Ansätze, die weiterhin wirksam, weiterhin richtig sind, und wir sind stolz auf die entsprechenden Erfolge. Inzwischen liegen 30 Jahre Erfahrung hinter uns. Damals waren wir sehr stolz auf die innovativen Strategien, die wirklich etwas sehr Neues hatten. Auch der von uns sogenannte Frankfurter Weg war mutig, ist aber auch umstritten bis heute. Der von uns sogenannte Frankfurter Weg war tatsächlich ein Paradigmenwechsel zu einem pragmatischen Umgang mit Drogenproblemen. Der neue Ansatz war die Fokussierung auf die Minimierung gesundheitlicher, sozialer Folgeprobleme, der Belastung für die Allgemeinheit und die Schadensminimierung statt einer Verbotspolitik. Die damalige Generation in der Medizin, in der sozialen Arbeit hatte mit sehr engen gesellschaftlichen Rahmenbedingungen zu kämpfen. Es war wenig Bewegungsspielraum. Doch wir haben gelernt, dass mit Solidarität zwischen den Städten, den Institutionen, den Trägern, auch der Polizei, der Justiz Lösungen gefunden werden können, die Spielraum eröffnen und es auch ermöglichen, den anderen jeweils dort, wo es gelingt, als gutes Beispiel zu nutzen, auch für unsere nationalen Ansätze. Die Maßnahmen des Frankfurter Wegs beinhalteten damals 1992 zuerst die Schaffung von 4 sogenannten Konsumräumen, die, wir wollen es offen sagen, trotz fehlender Rechtsgrundlagen von der Stadt eröffnet wurden. Aber immerhin damals, und so ist es bis heute geblieben, gab es bei falscher Dosierung sofort ärztliche Hilfe. Und sicherlich ist ein wesentlicher Erfolg, dass kein Drogenabhängiger bis heute in einem solchen Konsumraum an einer Überdosis gestorben ist. Dann endlich im Jahr 2000 die Schaffung bundesweiter nationaler Rechtsgrundlagen für die Einrichtung von Drogenkonsumräumen. Aber ich möchte es ehrlich benennen, auch erst seit dem 28. Mai 2009, das heißt nach 17 Jahren Erfahrung, dann das offizielle grüne Licht für diamorphingestützte Behandlungen. Zu den Zahlen, zu den Fakten. In den Konsumräumen in Frankfurt im letzten Jahr gab es 148.471 Konsumvorgänge mit über 3.500 Konsumraumnutzern. Die Zahlen sind aktuell wegen der Corona-Pandemie gesunken, die es auch den betroffenen Menschen schwerer machte, offen und in der Nähe sich zu bewegen, auch wenn in diesem Bereich natürlich immer wieder auch Dinge passiert sind, die nicht Corona-konform, nicht Corona-regelkonform sind. Der Vergleich zu 2019 zeigt, dass 78% der Konsumvorgänge intravenös sind, 22% inhalativ. Es geht um 85% Männer, 15% Frauen im Alter von durchschnittlich 41 Jahren. Die Substanzen in den Konsumräumen waren im Jahre 2020 50% Heroin, 19% Crack und in 30% beides. Die Drogenpolitik ist für uns vor allem eine regionale Herausforderung. Die Großstädte, sie sind Magnete für Drogenkonsumenten. 46% der Nutzer wohnen in Frankfurt, 26% im Staat, in Frankfurt umgebenden Staat Hessen, 29% in anderen Bundesländern oder sind Konsumenten auch aus dem Ausland. Das heißt, über die Hälfte der Nutzer kommen nicht aus unserer Heimatstadt Frankfurt. Aber, ich habe es gesagt, die Großstädte, sie sind Magneten. Sie sind Zentren von Kommunikation, von Verkehr und Mobilität und ziehen die Menschen an. Die aktuellen Herausforderungen in der Drogenszene im Frankfurter Bahnhofsviertel sind sehr heterogen. Es gibt langjährige ältere Drogenabhängige, schwere psychische Erkrankungen, ausländische Abhängige ohne rechtlichen Anspruch auf Hilfe, Geflüchtete mit schweren Traumata und Fluchterfahrungen, Haftentlassene. Die Hauptprobleme, sie sind weiter existent. Die Obdachlosigkeit, fehlende Krankenversicherung, ein polyvalentes Konsumverhalten, das heißt den Mix verschiedener Substanzen. Und natürlich hat die Verbreitung von Crack die Situation auf der Straße verschärft. Die Menschen konsumieren schnell auf der Straße. Es führt auch schnell zu Konflikten im öffentlichen Raum. Gleichzeitig steigt der Druck durch die zunehmende Gentrifizierung im Bahnhofsviertel, das heißt auch eine tatsächliche Aufwertung mit steigenden Mieten und auch szenigeren Nutzern des Viertels auf die Menschen, die ursprünglich dort für sich ein gewisses Eigenleben geführt haben. Das heißt, auch die Akzeptanz ist in verschiedenen Szenen auch unserer Stadtgesellschaft sehr unterschiedlich. Die Situation der gesellschaftlichen Probleme, die Auswirkungen sind in Corona-Zeiten wie im Brenngras nach oben erkennbar und transparent gemacht worden. Sie wurden offensichtlich. Deshalb hat Frankfurt mehr Hilfe für Drogenabhängige beschlossen, auch mehr Schlafplätze, auch längere Öffnungszeiten mit den Konsumräumen. Die Beratungsstellen sind erweitert worden. Angebote mit digitalen Mitteln sind dazugekommen. Substitutionsmöglichkeiten, Einrichtungen gehen auf Kosten der Stadt und gehen auch zum Teil ohne Krankenversicherung. Zu diesen Angeboten haben sich aber auch traditionelle Konzepte wieder dazugesellt, von denen der eine oder andere glaubte, dass sie nicht mehr kommen würden. Traditionelle Konzepte beispielsweise wie den Totalverzicht, der bei einigen Trägern Voraussetzung für Hilfen ist. Auch das wird akzeptiert und ist angenommen bei denjenigen, die etwas stärker sind als die anderen. Das heißt, Abstinenz ist nicht tot, sondern manchmal auch für den einen oder anderen der richtige Weg, der diesen Weg, auch wenn er scheitert, 2-3 Mal geht und es immer wieder versuchen wird und sehr stolz ist, wenn er es schafft. Aber es sind auch Fragen der Wahrnehmbarkeit mitzuklären gewesen. Wenn die Menschen auf der Straße konsumieren, dann sinkt die Akzeptanz. Und das, was wir erreicht haben durch die Drogenkonsumräume, ein Teil der Verdrängung eben in kontrollierten Rahmenbereichen, war insbesondere auch in den Phasen von Corona schwer durchzuhalten, weil die Strukturen sind durcheinander geraten. Deshalb waren wir sehr dankbar, dass es auch Vorschläge gab von unserer Polizei, die eben nicht nur ordnungspolitisch waren, sondern uns auch von der Wahrnehmbarkeit geholfen. Es hat unsere Polizei vorgeschlagen, Haltestellen zu schaffen, wo diese Menschen auch ohne soziale Betreuung abends sein können, einfach nur um da zu sitzen, was bei bestimmten Witterungsbedingungen durchaus bei denjenigen, die Übernachtungshilfen nicht angenommen haben, gut war. Die Polizei muss sich um solche Dinge nicht kümmern, sie tut es aber, weil wir gemerkt haben, dass da, wo wir auch in den Kopf des anderen hineindenken, das manchmal tatsächlich zu neuen Erfolgen und Erkenntnissen hilft. Meine Damen und Herren, ich bin überzeugt, dass das Nutzungsverhalten sich auch in Zukunft weiter verändern wird. Die anderen Herausforderungen für Suchtpotenziale, Spielsucht, Mediensucht, aber auch immer den Umgang mit weichen Drogen sind nicht gewichen. Deshalb ist auch aus unserer Sicht die Frankfurter Resolution, die wir damals mit den genannten Städten beispielsweise, auch Zürich, Basel, Bern, Amsterdam und vielen anderen mehr, diese Forderung noch aktuell. Ich möchte sie benennen. Das, was wir als Kommunen dringend brauchen. Die Entkriminalisierung von Drogenkonsumierenden, die Handlungsspielräume, um Substitutionsangebote ohne lange Genehmigungsverfahren auszuweiten, das einfache Bewilligungsverfahren für Modellprojekte, die Stärkung des Jugendschutzes bei illegalisiertem Drogenkonsum, die staatlich kontrollierte Abgabe von illegalisierten Substanzen, um Drogenhandel zu bekämpfen, sicher auch die permanente langfristige Evaluation drogenpolitischer Gesetzgebung auf ihre Wirksamkeit und schließlich die verbindliche Beteiligung unserer Großstädte bei Entscheidungen über nationale drogenpolitische Rahmenbedingungen und Gesetzgebung. Ich danke für Ihre Aufmerksamkeit.
Thank you very much, Peter. Anytime I hear these reflections proving and providing us with hard data, it's just fascinating for me to see how easy it sounds, but it's also fascinating for me to see how difficult it is to implement such an easy paradigm on philosophy in other cities or in other countries. Thank you for just sharing that with us. Now it's my great pleasure to introduce Mayor of Athens, Mr. Kostas Bakoyannis. Hi, Kostas. He was elected as governor of Central Greece from 2013 and 2019. And he was elected as a mayor of Athens in 2019. Athens had to courageously sustain and implement services at a time of financial crisis, with rising problematic drug use and stigma against people who are dependent on drugs. Even more, I'm happy to at least see you, Kostas, online, because I knew very well as a mayor of Prague your mother, and I spent a lot of time with her talking about many political agendas, including the social and health one. So please give her my best regards. So it's my great honor to welcome Mr. Kostas here, and Mr. Bakoyannis, the floor is yours.
Well, thank you so much for the kind invitation. It is indeed an honor to join such a distinguished panel. And of course, I'll be more than happy to pass on your greetings to my mother. I'm sure she'll be very excited to hear that you're doing well and that you remain active and engaged on all the big social challenges that we face as a continent, in our countries, and of course in our cities. Now, if I had to put a title, let's say, to my intervention, it would be that every crisis is an opportunity, or to put it differently and exhaust the cliches, that it's always a pity to let a good crisis go to waste. Let me start from the beginning. You mentioned the financial crisis. Unfortunately, and speaking in full transparency and in full disclosure, Athens lost precious time. Unfortunately, we have fallen behind, despite the heroic efforts of civil society, of a big number of organizations, and of our scientists. The public debate about drugs was trapped in dogmas that darkened minds. It was mostly geared towards repression and oppression, rather than actually recognizing the importance of harm reduction. And even worse, there were times that our public debate sounded very hypocritical, since we would rather put our hands in the sand than actually recognize the gravity and the urgency that we face. Therefore, we decided in September 2019 to assume the responsibility. I fully share the belief that it's up to us, up to the cities, up to local authorities. We have the capacity to work bottom up. Our actual know-how is on the streets, it's on the sidewalks, and we are the ones that are called upon to provide real solutions to real problems. In this context, the pandemic was actually a blessing in disguise. It was more of a catalyst, because very, very quickly, we were able to, number one, lobby successfully for the passing of a new legal framework for drug consumption rooms, where people could actually inject drugs that can be in a safe way under supervision. And at the same time, we have been able to secure the necessary funds for new mobile units that will actually be spread around the city in the upcoming months. Number two, the city of Athens played a key role in an innovative program called Prevention of Deaths from Opioid Overdose and Naloxone Distribution. Our aim is to, and it appears that we are very, very close as we speak, to constitute a law of non-prescription in naloxone use, which, as you all know, is an antidote that can literally save hundreds, if not thousands, of lives. This is a very important program for us that we are actually implementing, and it's supported by the partnership of Healthy Cities, of Vital Strategies, of Bloomberg Philanthropies, and it's implemented with a number of civil society partners. At the same time, we created a temporary accommodation hostel. We did this last year for those who lack shelter. We did it in cooperation with our organizations, whether it's Okana, Kethea, or Kaeda, and we focused on harm reduction. It's a multi-purpose dormitory with the ability to house 70 people. At the very same month, last year, actually during the first lockdown because of COVID, the city of Athens created a second dormitory, a second shelter for homeless people. It's again a multi-purpose homeless center, which has the facility to cover the needs of 400 people. We have also signed a memorandum of collaboration with some of our most active civil society partners that allowed us to implement HCV and HIV rapid tests, both in our temporary accommodation hostel, but also during our street work. And last but not least, we have had the opportunity to actually gain a lot of expertise and knowledge through our partnership in the Fast Track Cities Initiative. The common denominator of all our actions over the past 12 to 18 months has been collaboration. Collaboration with civil society, collaboration with authorities, collaboration with the government. It's very clear that when we unite our efforts, we can achieve a lot together. No one can actually respond to this crisis, to this problem on their own. It's all about actually getting together in the same boat. And the overall engagement with civil society, local government, and health policymakers is always the answer, especially if we want to be effective and achieve tailor-made results. So in closing, to sum up, there are three principles that are very important to us as we move forward. Number one, public health. We want to continue to develop drug policies that include prevention, counseling, treatment, and care programs, harm reduction, rehabilitation, and improved access to essential medicines and care. Number two, we want to focus more and more on development, which means refocusing drug strategies on development, poverty reduction, social and economic development amongst marginalized communities while ensuring reintegration to society. And number three, human security, which means refocusing drug law enforcement efforts on those who are responsible for controlling and expanding drug markets while ensuring the safety of all our citizens. Once again, many, many thanks for allowing me to participate in this particularly insightful and fruitful conversation.
Thank you, Kostas. The last speaker, and I am glad to have Jose Zuniga in this discussion today. Jose Zuniga is the president of the International Association of Providers of AIDS Care, and he has initiated and launched the Fast Track Cities, an initiative of more than 350 cities that signed the Paris Declaration and commit to reach urban settlements free of HIV as a public health threat by 2030. So Mr. Zuniga, welcome, and floor is yours.
Thank you for the introduction. It is my distinct pleasure to be here with you representing the Fast Track Cities Initiative, which, as you noted, is more than 350 cities around the world. I'd like to express my gratitude to the Global Commission on Drug Policy for the opportunity as well. As you all know, cities play a key role in local public health responses and bear so much of the burden of public health concerns. This is true with respect to HIV as well as respect to drug policy, as the Global Commission rightly notes in its new position paper, Drug Policy and City Government. Additionally, with increasing urbanization, the role of cities in public health is only growing more relevant, as we've witnessed during the COVID-19 pandemic. Fast Track Cities is an example of the concept of city multilateralism in which urban leaders, such as the mayors who are present today, have a seat at the global health table. This initiative has placed more than 350 cities front and center in action in the global goal of ending AIDS as a public health threat by 2030. And I firmly believe this type of collaboration can build consensus among diverse cities around the world to implement science-based and humane drug policy. Now, we know that HIV epidemics, drug policy are tightly interwoven. People who inject drugs are one of the groups most disparately impacted by HIV, and inequity is almost entirely preventable through harm reduction strategies. Additionally, we know that issues like stigma, poverty, and mental health that affect many people living with HIV are also closely connected to drug use. So I'd like to highlight Lisbon, which is home to some of the most progressive drug policy laws anywhere. They're also a leader among our Fast Track Cities network and will host our Fast Track Cities conference in October of 2021. Alongside Athens, Frankfurt, and Quezon City, Lisbon has proved that sound public policy on drug use can decrease new HIV infections. From 2007 to 2016, after the country decriminalized consumption of drugs and the city implemented harm reduction strategies, HIV transmission related to drug use dropped from 14% of cases among men to just 2%. Now, other cities have shown leadership on harm reduction strategies that could greatly reduce new HIV infections among people who inject drugs. These strategies are all in keeping with the Global Commission's new policy paper, whose first recommendation is putting health and safety first, ahead of politics, stigma, and fear. In Montreal, where 97% of people who are diagnosed with HIV are on antiretroviral therapy, and 92% of those are virally suppressed, supervised consumption sites have proven a very effective way of getting people not only clean syringes, but also a safe place to inject drugs and a connection to other services, such as HIV testing and prevention. Another Fast Track city, Melbourne, opened its first supervised consumption site in 2018. They built off success of another site in Australia. Out of 56,000 injections during its first 18 months, they had not a single fatal overdose. In the state of Victoria, people who inject drugs have had over 10 times the HIV prevalence of the general population. So this is critical for the city continuing to reach its HIV-related goals. Importantly, those cities benefit from national governments that have permitted these innovative harm reduction strategies. In the United States, the situation has been more challenging. The Justice Department here under the previous presidential administration vehemently opposed allowing cities or states to take action. Still, that did not stop Boston's former mayor from engaging in some city multilateralism himself and visiting sites in Montreal and Toronto, which led him to change his mind and support the initiative after initially opposing it. Massachusetts also welcomed leaders from Quebec to explain how creating supervised consumption sites is good public health practice. Now, several cities represented at today's event have also signed the Paris Declaration on Fast Track Cities and have committed to ending AIDS as a public health threat by 2030, including by addressing syndemic conditions such as substance use. These Fast Track cities include, of course, Athens, Geneva, Kingston, Prague, and Quezon City. And we're very proud of all the great work you are doing in this space, as well as in relation to maintaining a continuity of HIV services during the COVID-19 pandemic. Together, these cities represent different continents, different socioeconomic conditions, and different policies on topics relevant to HIV responses, such as sex work, LGBTQI rights, and substance use. But they've also embraced the first recommendation of this Global Commission new position paper, putting health and safety first. They've also embraced the second recommendation, ensuring that local policymaking includes everyone involved. That is because another central piece of the Fast Track Cities initiative is community engagement. This is another major advantage of cities compared to national governments. They are better connected to community leaders and are often much more successful at partnering with stakeholders. So in conclusion, we hope that the Fast Track Cities initiative can be an example of how city multilateralism can advance public health. And we also hope that we can be a partner in this effort for more humane, science-based drug policy in urban settings. Beyond the medical connections between HIV and drug use, are the powerful socio-political connections around ending stigma and marginalization, advancing equity, and as important, evidence-based practice. That makes us natural allies in our respective efforts. Thank you very much.
Thank you very much, Mr. Zuniga. Thanks to all panelists. I'm just now looking at my watches, and it sounds like we have not more than 5 minutes for the discussion. And I'm wondering if we can maybe have 2 or 3 minutes more. So I will ask, because I didn't receive any question on chat. So I have one question, Jose, to you, if you allow me. And this is, what can drug policy reform at the local level learn from your initiative, from the fast track cities, and how can cities commit to better drug control as they did to reinforce their HIV response? So please give us some of your suggestions.
Thank you very much for the questions. It's a complicated response, but I'll keep it as simple as possible. I think key to the success of the Fast Track Cities initiative has been a leveling of the playing field to ensure that in addition to the political will and commitment and leadership played by mayors and other urban elected officials, that community have a key role to play in both keeping us accountable to the targets and goals that we commit to, but also engaging actively in outreach and in implementation of programming. Too often, we take a top-down approach to these types of initiatives. And very clearly, as we've heard from the mayors of Athens, Frankfurt, and Quezon City, they represent the opposite perspective on that practice. That to me is absolutely critical. It's been helpful for us with respect to the HIV response, particularly as we try to reach the hard to reach populations who are traditionally socially marginalized and unfortunately the victims of inequalities and inequities that persist in our society.
Thanks a lot. If I may, just to ask a question also and address that to Joy and Peter. Based on your experiences, would you subscribe to the idea that current global repressive drug policies create more harm than they provide solutions to the illicit and illegal drug markets?
You know, that's a very difficult question for me to answer because you're probably familiar with the political scenario in our country, the Philippines, and you probably are familiar with our president's war on drugs approach to ending the drug menace in our country. And well, I'm grateful to have to report to you that in our city, while we try our best to cooperate with the national government, we also developed our own way of addressing the problem of illegal drugs by not adopting a punitive or a violent way of dealing with the problem, but instead we had a very humane, human rights oriented perspective towards the drug problem. And we in fact ended up becoming a model for the entire country by putting up our own system whereby we took in the drug surrenderies rather than subjected them to punitive action. We treated them well. We gave them clinical and psychological treatment. We gave them spiritual advice, etc. And then after 24 weeks of counseling, they were released. We were monitoring them and we gave them jobs. And I think that was something that many let's say media personalities who came to our country thinking that they were going to see violence all over, were quite surprised to see in our city. So I do not subscribe to violence and punitive action against persons who use drugs. Instead, I subscribe to a more human rights oriented perspective, and I think that's the more effective answer to that problem here in our country.
Yeah, thank you for the diplomatic answer. Thanks. Peter?
Sie haben gefragt nach der Repressionspolitik und wie sich das verträgt mit den Ansätzen, die wir verfolgen wollen. Wir haben damals schon 1990 in der sogenannten Frankfurter Resolution gemeinsam mit den erwähnten Städten in Deutschland, Hamburg, Dortmund, Hannover, in Holland, Amsterdam, Rotterdam, Venlo, Arnhem, in Italien mit den Provinzen Rom, Teramo, Forli, Catania, in der Schweiz, Zürich, Basel, Bern, Luzern, Belgien mit Charleroi, mit Kroatien, Zagreb, Slowenien, Ljubljana formuliert, dass wir als Unterzeichner unterscheiden wollen zwischen der Hilfe und der strafrechtlichen Verfolgung, die mit dem Handel verbunden ist. Die strafrechtliche Verfolgung haben wir damals betont, und das sehe ich bis heute genauso, die Priorität auf die Bekämpfung des illegalen Drogenhandels legen, insbesondere auch den Schutz der Bevölkerung als eine Aufgabe der Polizei, und haben formuliert, wer Leid, Elend und Tod verringern will, muss die Süchten von dem Druck der Verfolgung wegen des Gebrauchs befreien, darf zweitens nicht die Hilfsangebote an die strikte Abstinenz koppeln, sondern es geht um Ausstieg aus der Drogenabhängigkeit alleine, sondern vor allem ein menschenwürdiges Leben für alle. Daraus kam dann die Politik mit sterilen Spritzen, die Konsumräume und vieles anderes mehr. Ich möchte eine Einschränkung aus unseren Erfahrungen in diesem Zusammenhang bringen. Ich glaube, dass diese Hilfsangebote, auch das zeigt die Erfahrung aus Frankfurt, nur dann funktionieren, wenn sie auch mit einem gewissen, ich sage mal, sanften pädagogischen Druck auch verbunden werden. Das heißt, wenn man einfach nur herumläuft und da ist, aber von den Erfahrungsangeboten, von den Hilfsangeboten nicht erfährt, auch die Polizei nicht geschult ist, darauf zu verweisen, dann geht dies ineinander nicht gehen. Wir haben die Erfahrung gemacht, dass die Repression, die auch unsere Polizei teilweise mit ausübt, nicht um die Menschen, die süchtig sind, zu bestrafen, sondern sie in die Angebote hinein zu komplementieren, zum einen zu schubsen, auch manchmal zu bringen, wenn jemand sehr hilflos ist, durchaus eine sinnvolle Ergänzung auch ist von dem, was wir unter Akzeptanz von der betroffenen Situation steht. Das heißt, auch die Angebote sind besser genutzt worden, wenn die Polizei gesagt hat, wo es was möglich ist und wo etwas nicht möglich ist. Ich meine damit nicht die Situation, wie es mir berichtet wurde, aus einer bestimmten Phase in Italien, wo man Drogensüchtige genommen hat, aus den Städten rausgefahren hat und vor den Städten ausgesetzt hat, so ist es uns berichtet wurde, sondern dass man direkt vor Ort sagt, dort geht es und dort geht es nicht, und damit auch die kontrollierte Abgabe ein Stück unterstreicht mit einem Ausrufezeichen versieht. Wir Menschen sind eben nicht nur belehrbar, nicht nur klug, nicht nur selbstständig, sondern auch manchmal richtig verrückt, und unter Drogen ist das nicht unbedingt leichter. Von daher glaube ich, dass das Ineinandergreifen von Repression und Prävention, die ein Bestandteil des Frankfurter Wegs immer war und auch ist, durchaus sinnvoll ist. Das heißt, das eine funktioniert mit dem anderen, wenn es koordiniert und abgesprochen ist und die Frage der Repression und der Prävention nicht Feinde sind, sondern eben in offenen Büchern gegenseitig die Lesbarkeit, die Strategien durchschaubar machen und ineinander auch greifen. Das ist ein Ansatz, den ich bis heute vertrete. Das heißt, Repression ist nicht per se schlecht, Prävention ist nicht per se die Lösung, aber Repression ohne Prävention ist ohne Sinn.
Thanks a lot. Glad to hear that. Finally, Kostas, you have 60 seconds, not more.
Well, I would.
And this is, well, wait. This is the most difficult question. Tell us in 60 seconds, how do we shift the policy view on drug control, making pragmatic responses as the mainstream and repressive, harmful enforcement the margin? Give us your suggestion.
by getting results. It's as simple as that. And that's actually
Okay.
the competitive advantage of local authorities and local governments, that we are judged by tangible results. It's not about words, it's not about theory, it's about praxis. It's about getting things done. Let me give you the example of the city of Athens. When we first set up our shelter a year ago, many people thought that we had gone completely mad. Many people thought that it was, COVID somehow had actually altered our minds. But it has worked. The statistics are very positive. The numbers are very good. So immediately the discussion went to the next level. So we should never forget that it's great to have, set political dilemmas. I mean, the work in mass communication, it's great even if it could even be acceptable if these dilemmas are artificial, like the one you mentioned before and asked my fellow colleagues. But at the end of the day, it's about being practical.
Thank you very much. Thanks to all of you. And now I'm passing the chairmanship to Mr. Chairman. Thanks a lot.
Thank you very much, Pavel. It was very interesting also the tension between national and local policies, which should be complementary and sometimes are not easy to combine. J'ai été informé que le Dr Fels, qui est maire adjointe de Strasbourg, souhaiterait intervenir. Madame Fels.
Bonjour, est-ce que vous m'entendez?
Oui, alors c'est Monsieur Fels, désolé. Alors.
C'est pas grave, c'est pas grave. Donc je suis médecin addictologue et adjoint à la maire de Strasbourg en charge de la santé et des addictions.
D'accord.
Juste une minute, puisque je crois que je suis une seule ville française à être représentée. Dire que nous avons, nous, cette distorsion encore plus violente. On a un système de répression sur les drogues qui est à un niveau très très fort en France, encore avec une aggravation récente des amendes uniquement pour les consommateurs de cannabis qui viennent renforcer encore une législation qui date de 1970. Vous voyez, quand on dit ça, on se dit que ce n'est pas possible que la loi n'ait pas évolué, elle n'évolue pas aujourd'hui, avec 2 expérimentations seulement à Strasbourg et à Paris de salles de consommation à moindre risque. Nous sommes beaucoup servis à Strasbourg dans le débat qui a été apaisé avec les expériences allemandes et suisses, et je voudrais vraiment les remercier parce que pour nous, ça a été vraiment un apport très positif puisque les Alsaciens ont entendu, les Strasbourgeois, que si nos amis allemands et suisses, depuis maintenant 20 ans, 25 ans, font cela, c'est qu'ils ont de bonnes raisons. Et donc, on a, nous, eu un débat tout à fait équilibré, ce qui n'est pas le cas à Paris. D'autres villes veulent s'engager maintenant, donc c'est une bonne nouvelle. Il y a eu des changements politiques importants, notamment l'arrivée de l'écologie dans les grandes villes, et donc d'autres villes veulent aujourd'hui s'engager. Et je faisais donc l'information que le 1er juillet à Strasbourg, on fait donc un colloque des villes européennes qui ont donc des salles de consommation à moindre risque. Et à Strasbourg, dans une innovation française, même si ça existe ailleurs, nous allons mettre en place un hébergement santé en lien avec la salle de consommation, juste au-dessus, qui vont permettre à des gens très désinsérés, à la rue, d'avoir un hébergement et des soins, mais aussi de pouvoir consommer ce qui, pour en France, est complètement innovant et complètement expérimental. Et on est très heureux d'avoir pu pousser cela. Mais comme les collègues l'ont dit, je pense qu'il faut qu'on pousse. Aujourd'hui, je pense que la population, d'ailleurs, une étude a montré que près de 80% maintenant des Français sont favorables aux salles de consommation à moindre risque. Il faut pousser les politiques nationales. Je pense que la population comprend, comme les collègues l'ont dit, lorsqu'on donne des chiffres sur la réduction de la mortalité, lorsqu'on donne des chiffres sur l'insertion, sur le retour à l'emploi, à l'hébergement. Donc, voilà, vous participez, on participe aussi à ce mouvement-là. On espère que nous allons tous ensemble essayer de faire évoluer cela. C'est important pour la sécurité publique et pour la santé publique. Voilà, merci beaucoup de m'avoir donné la parole et je trouve vraiment passionnant de pouvoir donner ce pouvoir, disons cette parole aux pouvoirs locaux. Merci beaucoup.
Merci beaucoup, docteur. Effectivement, ça nous fait plaisir aussi d'entendre une voix française qui nous donne un signe d'espoir, parce qu'effectivement, en France, la politique nationale a l'air encore très axée sur la répression, et nous savons que la ville de Strasbourg, en général, est une ville innovante et créative. Merci. J'ai le plaisir de passer maintenant à la deuxième session d'échange en matière de meilleures pratiques et de coordination, qui sera modérée par Camélia Kemileva, qui est donc directrice exécutive du Geneva Cities Hub, avec la participation de Delroy Williams, maire de Kingston en Jamaïque, Svante Merrick, maire de Ithaca aux États-Unis d'Amérique, et Tom Synan, qui est de la Law Enforcement Action Partnership aux États-Unis également. Camélia, je te passe la parole. Merci beaucoup.
Thank you very much, Mayor Kanan, to say that you're president of the Geneva Cities Hub. So it is a pleasure and an honor for me to be here today to moderate the second part of the debate. Just one sentence to say that the Geneva Cities Hub has been created by the City of Geneva, the Canton of Geneva, and the Swiss Confederation, so the three levels of the authorities here in Switzerland, precisely to push the possibility for cities to sit on the table with the states to discuss issues of common interest. So I very much liked what Mayor of Frankfurt said, and now just the Strasbourg municipality person, that there should be a mandatory participation of cities in drug policy and legislation. This on national level, I agree, but also what we do at the Geneva Cities Hub, we try to bring cities directly on international level, where sometimes you can do influence on states, on your own state, but also you can gain influence for other cities to influence other states and multilateral diplomacy. It looks abstract, but it works in reality because it is a peer pressure between states and cities. With this and with the question in mind, how cities can sit with states, with regional governments to shape the drug policies in their countries and also beyond their countries, I like to turn to our panelists of this second part of the debate. Mayor Svante Merrick, who I had the pleasure to moderate a debate with him 2 days ago, already on a city diplomacy topic. Definitely we see each other on Zoom for the second time, and third time it will be in presence. Sir Tom Synan, who is chief of the police of Newtown, Ohio. So I find myself with two American people here in Geneva, which is quite nice. Hi, Tom. And I need to apologize, apparently, Mayor Williams from Kingston, who will be connected quite quickly, I presume and I believe. So turning first to Mayor Svante Merrick. Mayor, you have been in your third mandate and you have an Ithaca plan of action about prevention, treatment, harm reduction, and repression to address the opioid crisis, overdoses, and over-incarceration. So the Ithaca plan is an innovative approach that interests many other US cities, such as Philadelphia, New York, and Seattle. So could you tell us more about this, and also don't forget to tell us how you think you can influence this legislative part of it in the US and beyond the US as mayor of Ithaca. You have the floor.
Well, thank you very much. It's good to see you again, and it's good to see so many of my idols and role models across the world here. There is nothing quite like the Society of Mayors. I think the panel discussions today demonstrated why. No matter the culture, mayors are the most popular form of elected officials in the world. I don't know if you know that, but on average, they poll in the mid-70s. while members of federal legislatures are typically in the teens or the 20s, somewhere around used car dealers is about the same level of approval. Why is it that mayors are so successful? Well, it's demonstrated today. They're all obviously very good looking, but also very grounded, right? Closest to the people. And as I believe it was the mayor of Frankfurt said, most relied upon to deliver results. You know, it is one thing, often our legislators, they talk and they talk and they talk, and that is good enough to keep their jobs, but we're expected to see results. And the results in our country, I have to tell you, I'm sure I won't be breaking any ground by telling you that we've waged an intense war on drugs here in the United States for the last 60 years. The result of that war on drugs is that we've incarcerated more people, a larger percentage of our population, than any nation in the world. And we failed to make meaningful advances in keeping people alive, helping people recover from drug dependence and abuse, and keeping our communities safer. And I'm a product of that war. I should tell you that I was born in 1987, which was about the worst time in American cities, especially inner cities. I was born in inner city Tampa Bay, Florida. My father was a service member who started using drugs in the service, left my mother with the rent money when she was about 7 months old. So I lived the first 6 months of my life in a homeless shelter, the first 8 years of my life in and out of homelessness, as my father himself was in and out of prison and mandated drug treatment. And I always thought that this was a personal failing, a personal shame, that that my family was to be blamed for how much we struggled and suffered. And it wasn't truly until I became mayor. I was elected mayor 10 years ago. And I realized that I was sitting atop a local system that executed very much the same war on drugs and was getting very much the same results. And so I put together a commission. We studied many of the mayors and cities here, most especially the Zurich model and the Swiss model. Our plan ended up also being based on those 4 pillars. And from harm reduction to treatment, we really, really focused on public health. The results have spoke for ourselves. We were the first city in the nation to call for safe consumption sites. We were the first in the nation to make things like overdose reversal drugs available over the counter and on demand. And not only has crime decreased in our community, but overdose deaths have decreased from their peak, and we are seeing more people enter treatment. None of this is news to the folks here. I think we're well grounded in the ways that a public health approach and the 4 pillars approach can actually increase safety and reduce the negative effects that come with drug use. I do just want to say for a second what might be the elephant in the room, which is that America's war on drugs was enacted in large part and continues to this day to function as a way to remove the rights of minoritized people, especially people of color, in particular Black people. There's a reason why certain drugs in the US, from crack cocaine, all the way back 100 years ago, when opium was the first drug really made illegal in California in order to target Asian Americans especially. These laws have been used to the effect of not only incarcerating people of color, but keeping them in poverty for longer. That is a somewhat controversial thing to say in the United States, but it is true nonetheless. And unless we reckon with it, we will continue to see what I'm sure the global community witnessed for the last year in the United States, which is the largest civil uprising in American history, as people were rebelling against law enforcement. And I just have to say, as the leader of a police department, we've proposed some intense reforms, and in fact, creating a new public safety department to replace our traditional police department that will have armed and unarmed officers, in fact, very much a European model. But much of the rage and the angst and the concern that has been aimed at law enforcement is in fact misplaced. And in fact, the men and women who wear the uniform and execute these laws are only in fact carrying out orders that we as a society have asked them to do. And so if we want to see peace in our streets and a more just society, it's important that we pursue police reforms here in America, but it's also important that we actually change our drug laws so that we are asking the police to do less of the things that put them in harm's way and put members of our communities in harm's way.
Thank you very much for these very concrete thoughts, and I wish obviously to see them also in writing so we can share this with even more people who follow the debate. But have you ever been called by Washington saying, come here, explain us on a federal level, or how it works with the federal government? How do they, what is your influence on them, do you feel?
Yes, I have been called by Washington. I have also been called crazy by Washington. In fact, when
I don't doubt.
Yes, when we released the Ithaca Plan, it was the last year of the Obama administration. And President Obama's staff did in fact call me, and we had many long conversations about the pros and cons of pursuing such intensive harm reduction models. They were ultimately, you know, I think this went further than they were comfortable with. I attempted to press them to adopt this as a standard. But there were still great openings, particularly as it came to reforming our drug laws and reforming mass incarceration in the United States. In fact, out of 100 United States senators, only 2 opposed serious reforms to mass incarceration. Now, the problem is when President Donald Trump got elected, he chose one of those 2 United States senators, Jeff Sessions, one of those 2 that were in opposition, to become his attorney general and head of the Department of Justice, which truly set back the cause of ending our era of mass incarceration and unwinding the war on drugs. I'm hopeful that the new federal administration, the Biden administration, will have a more progressive stance. They have so far been laser focused on economic recovery and of course combating COVID. So they have not been as focused on this issue, but it is my sincere hope that in the next 3.5 years, we'll be able to make more concrete steps, especially since when I was talking to the Obama administration, we were the only city that was in support of safe consumption sites, for example. But now with cities from Boston to San Francisco to New York City in support, I hope that we'll have a broader coalition to press for changes at the national level.
I hope so for you, and I will have another question for you later on, as well as if I'm allowed to switch between panel to the mayor of Frankfurt, of how you can export practices and how you can influence your national governments, Berlin in your case, mayor, but also would you come here in Geneva or Vienna, basically? It will be the international drug policies where states debate this, and if you go to this national big guys government in Vienna, because Vienna is the United Nations office where drug policies are dealt by, what would you tell them also, again, something which can indirectly influence also the meaning of your own national government about the role of mayors and about the local governments. And sorry, I'm preaching what we preach at the Geneva Cities Hub, but this is what is it. Turning now to the second panelist, who is Tom Sinan, the chief of the police of Newton, Ohio. He has experience in being confronted by problematic drug use, I don't doubt, as chief of the police, And you saw the impact of repressive policies on dependent people and their families, especially in the context of the opioid overdose crisis in the US. And you're a member of this LEAP, Law Enforcement Action Partnership, which is a network of police, prosecutors, judges, and other law enforcement actors, lawyers basically, and non-lawyers, advocating for justice and drug policy reform. So again, tell us about your experience, and don't forget to tell us your opinion about what is the role of the local authorities, mayors and local governments in this whole story of dealing with drug policies, be prevention, be repression, or rather prevention. So floor is yours. Thank you for being with us.
Thank you so much for having me. I am honored to be here with this group and to discuss this very important topic. A little background, I am the police chief of a very small town called Newtown, which is just outside of Cincinnati, Ohio in the United States. I've been here for 28 years, but in my 21st year, I had the unfortunate experience of seeing an entire family, an entire generation die from addiction in my small community. A mother and all three of her sons. The mother from abusing prescription pills and alcohol. The youngest son was shot and killed by crack cocaine. The oldest son overdosed on heroin and fentanyl. And then the last of the sons, who we actually had revived, first responders revived him. We, at the time, didn't have necessarily a community group or effort. We tried to get him help, but unfortunately he did not want it at that time. We felt that the only option we had to try to keep him alive for at least one more night was to take him to jail. We accomplished our mission of keeping him alive for one more night. He got out, did what was left of the heroin and fentanyl, overdosed and died. That event changed my view on addiction, especially from a law enforcement perspective. Now, each one of those brothers had children themselves. The oldest had 5, 3 of which struggled with substance use disorder. This event was kind of a catalyst in not just my small town, but this county, this region, to form a coalition, a community-based response to addiction. And as has been mentioned, it is really based off the 4 pillars of public health, prevention, treatment, and then whether first responders or law enforcement. We did something a little bit different in the beginning, in that it was important that each one of those entities was represented by the head of that group. This became critical, especially in responding to the introduction of carfentanil, which Cincinnati was one of the first cities in the United States to see carfentanil hit the streets. In 2016, the introduction of that synthetic opiate carfentanil, and now the staple of fentanyl, caused nearly 1,000 overdoses and 3 deaths in that 1 week. Because we had the heads of each one of those agencies, we were able to respond more rapidly to those conditions of getting naloxone out to police officers, firefighters, citizens. And there is no doubt that that collaboration, that immediate response, especially with naloxone, saved many, many lives, not only that week, but continued on. Now, we've done something a little bit different with our coalition. We've kind of transitioned from the Hamilton County Heroin Coalition to now what is called the Hamilton County Addiction Response Coalition. Understanding addiction impacts every part of the community, every demographic, every area of the community. We now include in our coalition on the steering committee the African American and business community. Again, the heads of each one of these agencies so we can respond quickly. This again was important when COVID hit. Because this group and the heads of each one of those agencies is sitting at the table talking to each other, we're able to immediately break down barriers. This allowed us going into pre-lockdowns, lockdowns, and coming out of lockdown to be much more responsive and quickly get back out. When the country started opening up and our community started opening up, we were able to get some of our innovations out there much more quickly and stabilize what we were seeing out there. And we recognize that housing, economics, employment, transportation was all part of an addiction response, and it was imperative that we had that group. Now, we started this group back in 2014-15 with about 9 original members. We currently have 40 different agencies, about 100 people that are involved in it, and representatives from local, state, and federal government all sit on this coalition and attend meetings. And the goal of this coalition really is to break down barriers and to start providing innovations and to do things differently and how we respond to addiction, not only from the street level, but also from the government level. So some of the innovations and some of the programs we use is our public health department has a mobile needle exchange van. Now they're not just exchanging needles, they're also testing for HIV, hepatitis C, and connecting people immediately to treatment if that's what they wish. One of the programs that we utilize, and it's underneath the group that I sit on, what we call the Interdiction Committee, is the One Stop Resource Center. This was actually developed within the Office of Reentry, which is a group that works within the jail to try to prepare people when they get out with transportation, housing, employment, skills that they need coming out of jail. We found that one of the biggest hurdles when it comes to addiction response is if someone wants help here in the United States, if they don't have insurance and they need to sign up for Medicaid, they need a birth certificate in order to get an ID card in order to then get treatment. That was challenging because if you don't have transportation or you don't know where to go, you are literally traveling miles to try to get each one of these resources. What the One Stop Resource Center did was instead of you traveling to all those different resources, we brought the resources to you. And actually, it was kind of, people thought at first we were crazy that we held it in our justice center, our jail system. But the reason why we held it there was because when people get out of jail, they can immediately be connected to services. People within the community can come into that resource center. And what is different with this is each provider has to actually provide a resource, not just a pamphlet. So we have people getting their ID cards, birth certificates, and then signing up for Medicaid to help them get into treatment. There's mental health and also addiction assessments that are completed right on the spot, and people can be driven right to treatment. We also have quick response teams, which are police, fire, and addiction specialists led. Now, this at first was kind of reactive post-overdose, but they are now transforming into also being proactive, and we're using that quick response team to connect pieces of the system. So if a person falls out of the system, we're able to connect with a human being, with navigators and a quick response team to be able to connect them back into care. The Cincinnati Fire Department is one of our strong partners. They've actually initiated a program to where they will automatically, through a doctor, prescribe medically assisted treatment to those that overdose. If that person does not want to go to the hospital or wants to go to treatment, they will drive them directly to treatment, what we call our engagement center, which is a 24-hour, 7-day-a-week program where people can start getting treatment and care immediately. We're also using a law enforcement assisted diversion program, the LEADS program. And we started another program that's connecting all these pieces called the Hotspot, which we started about a year ago, and really working to bring the resources down to a community block. So we can tackle the micro issues, but also deal with the macro issues of trying to connect the systems. Now, all these programs are very innovative. They are very law enforcement driven. They're very much about change, but here's one of the hurdles. And the mayor kind of mentioned this a little bit. In the United States, addiction is still seen as a crime. Yeah. That is a significant hurdle because instead of it being looked at as the chronic mental medical health condition, and instead of it being healthcare driven, what you really have to do is have a community come together to take these pieces and try to snap them together, to try to form a continuum care model. Yeah. This is a hurdle because it's not the most effective or efficient way to do a continuum care model, but the good news is because of this coalition and community-led effort, it's breaking down the barriers and it's a shared collaborative. It helps us respond better to addiction.
Not to interrupt you at all, because it is very interesting, and I actually have in mind already to invite you to a law enforcement, more oriented meeting. But if there is to be a takeaway from the diverse public we have here, what will be like the 3 main spots you would say that works? I mean, we've heard you, repression, prevention. What are the 3 main tips you want to give for the meeting? And then I will switch to the questions to the other panelists. Thank you.
Sure. Thank you. One of the big keys to this is it has to be a community-led effort. In order for us to change the stigma, in order for us to move from addiction just being a crime to a mental medical health condition, it has to be a community-led effort. So that's important. You have to bring partners, advocates, treatment, prevention, your local and state and federal elected officials so they can change policies, but also get funding and help connect those pieces. To me, that's probably one of the most important parts is that it is community-led. It is a collaboration. So not one part of the system is taking the burden of all of this, but it is a shared community response. And it also, by sharing it, it allows us to change that stigma and it humanizes addiction to be able to then be treated as a healthcare issue. To me, out of all the other things, let alone 2 or 3, that is the biggest point.
Thank you so much. That is well noted by the organizers, I'm sure. Turning now to the 2 mayors we have here, so Mayor Svante Mirik and also Mayor of Frankfurt, if I may, for a moment. So 2 questions. What is in the reduction, in the harm reduction services, in the whole policies, what is the main problem? The public opinion, as you have to be elected as politicians, the funding, the cooperation of other stakeholders. So what is for you the main challenge, not say problem? And my second question, which I have already asked, how do you think you can influence national policies, national governments, Washington, Berlin, and beyond? Do you see a place for you at the United Nations interstate multilateral negotiation table? So getting first to whomever, probably Mayor Mirik.
Sure.
Yes.
Great questions. What is the biggest problem? The 3 you proposed as the largest problem are really interlocking. You know, getting public opinion, convincing the public that this new approach will lead to better safety is difficult, but it is necessary if you're going to win public support for the funding and if you're going to get other stakeholders on board. And that's really the problem here in the United States. In the US, cities are often laboratories of democracy, as the police chief was saying quite eloquently, because you are faced with real problems and real people, and you see the failures of our policy. That is often why cities adapt and react. State governments and federal governments are often a bit more removed. And so getting them to loosen the reins, the regulatory reins on cities, as well as providing them with more resources is really the battle. It's my experience that cities have too much responsibility and too little power, while the federal government has too much power and too little responsibility. And if we could shift that balance, if we could convince the national government to give localities the flexibility to run their communities as they see fit, we would see real-time, experiments is a word that scares people, but we would see real-time demonstrations of what policies were effective, what worked to save lives, what worked to keep people safe. And then what you'd see is copycats. I'm not sure the translation for copycats, but you'd see people following the lead of the cities that are getting the best results. How to do that, to get to your second question, I do think it is necessary for institutions like this one and for civil society in general to inject local leaders into the international conversation, allowing them to exchange ideas across borders, but also to speak directly with other heads of state and their own heads of state is an important and extremely crucial role for civil society to take, because oftentimes there are political, I don't know how to say this politely.
Say it directly.
Say it directly, okay. That's the beauty of talking to Swiss folks. My second favorite nation in the world is that I can tell when they're trying to say something politely, they'll speak in French, and then when they switch to German, I'm like, ooh, they're going to make a direct point. The politicians don't get along with each other. It's sort of in our nature. We see each other as competition, and we talk more than we listen, and we should listen more than we talk. And what civil society can do is level the playing field, get elected officials and politicians to listen to experts, listen to each other, and follow the evidence.
Thank you so much, really. That's what I would say also, but good, very important thing to remember. Thank you very much, Mayor Mirik. Turning to you with the same question, if you don't mind, Mayor of Frankfurt.
Of course, the public opinion is always a strong factor. If you don't have the recognition and the acceptance in the population, you're in troubles. You feel it very directly, especially when you start new projects that are close to traditional living areas. The acceptance is very low. And if you want to change things, always people are not in favor of changing things. They like to live as they did in the past. And if there are areas where they know there are troubles, after some years, they start to accept it. But they don't want it into the front of their house. So if it's far away from everybody, nobody really cares. If it comes close, you're in troubles. So this is the same situation, I think, for all local officials, how to bring a distance to the problems that don't keep the problems far from you, but don't let them too close that everybody becomes nervous and think there's taking a revolution in front of his door. So this is nothing specific on drug politics. It's a general trouble that we are in. So you have to persuade nearly everybody that something, a new way is a good way, especially in the dialectic of repression and helping people. It's, I pointed it in my last remark. You need also the sides that are from the traditional repressive sector. If they are in concurrence to the people that want to help, it's always troubles. So both have to learn what they eat, what they get from the other side. And if you're in a framework where the police knows that they have less clients for their work and help us to have more clients for the social work, everybody profits a little bit. So the second thing you ask, what is to bring topics like this on the national or international sector, I use always a very strong framework that we have. We have an organization, an institution of the cities in Germany that cooperate on a national level as a lobby organization for the cities and also sometimes also for against the national level and also to bring on the international level. What helps if you have strong partners also, not only in your own country, but also in the international sector, frameworks, networks like this. And also our city partnerships help a lot because they're the ones that trust us and we trust them for years. We have sister cities in the United States, in Turkey, in Israel, in Egypt, in South America, and we honor them very much and we like very much to be together with them. We have sister cities which sometimes have a totally different way of thinking, like Budapest in Hungary, not only in the drug policy, but also in the treatment of refugees, as you know. So we fight, we struggle, and we argue, but it helps also to understand them and them to understand us, and that not to get out of the room with the feeling the others are quite naive or stupid, they don't know what we know, and to be arrogant, but the opposite, to respect each other.
Thank you very much for these very frank and direct answers. I definitely need to turn to Mr. Canaan, President Canaan, President Dreyfus for the closing remarks. But I'm sure that Mr. Kazachkin, who is here on my right, he will be happy to help you with these closing remarks. So if I can offer 1 or 2 minutes of your time to him, with just one actually question, which is right now, as you listen to the debate, what you retain without thinking further, what is your immediate take from this debate now?
Thank
1
you.
minute, 2 minutes
Thank you.
maximum.
Well, my immediate take is 3 points. The first is that repressive drug policies take us nowhere. They're wrong, they're harmful, as we heard this terrible anecdote from the chief of police from Ohio. My second point is that mayors, law enforcement, and the health sector, each of them and all of them together can put together an extraordinary array of innovative harm reduction measures. And I've heard today some examples of measures that I hadn't heard before. So thank you for that to all of the speakers, but I can see the power of these 3 components of the response. And my third point is that the most difficult challenge for the future will be, as just discussed, how to close the gap between the evidence that we gather on the ground and then the national and international debate. And that's why we also need networks of parliamentarians, just as we have networks of mayors, and maybe all of these networks coming together. And at the international level, we need to reopen the debate, and I think all of us at the Global Commission on Drug Policy are committed to that, and maybe one day revisit the conventions.
Thank you so much, Mr. Kazachkin. Good that I gave him the floor. He did part of it, so please.
Merci, bien sûr que c'était excellent d'avoir une conclusion et un résumé de mon ami Michel Kazachkin, membre de notre commission globale et dont l'expérience dans la lutte contre les maladies transmissibles est connue de tout le monde. Je vais du coup me résumer, je crois, à un mot, à chercher quel est le mot, le maître mot que l'on peut trouver dans tout ce qui a été dit aujourd'hui. Et bien sûr que c'est difficile de résumer une telle richesse d'expérience, mais je crois que le maître mot, il a été effectivement prononcé par Tom Sinan quand il disait « Our duty is to connect pieces ». Connect pieces, c'est vraiment au niveau le plus proche des habitants, c'est-à-dire au niveau des communes et des autorités municipales, mais qu'il est nécessaire de mettre en commun les différents aspects de la politique drogue et de veiller à ce que l'un de ces aspects ne sabote pas les activités dans un autre aspect. Nous avons eu la chance en Suisse de pouvoir également mettre ensemble les tenants les professionnels de la santé, les professionnels sur le plan du social, les policiers, les magistrats, de façon à ce que chacun comprenne quel est son propre rôle, quel est le rôle des autres et comment veiller à ce que tous ces rôles puissent, encore une fois, coopérer à une nouvelle politique. Connect Pieces est poussé à poursuivre la pression sur les autorités nationales par la mise en réseau de toutes ces expériences faites à la base au niveau des pâquerettes, comme on dit en français. Donc voilà, je remercie pour tout ce bouquet d'expériences et nous allons continuer dans cette voie pour que les villes puissent faire entendre leur voix et entendre les expériences qu'ils font.
Un très grand merci, Ruud Dreyfus, pour ces mots à la fois inspirants et encourageants et responsabilisants. Effectivement, moi-même en tant qu'élu local, avec tous mes collègues ici présents ou connectés en ligne, il faut être honnête, on est parfois dépourvu face au fléau de la drogue dans sa variante les plus envahissantes, dans ses variantes perçues comme négatives, source de tension, de violence, de frustration, de maladie, avec le risque qu'il y ait d'abord un réflexe de vouloir régler ça uniquement par la répression pour faire disparaître le problème. Et on sait qu'il ne disparaît pas. Et les premières victimes de tout ça, c'est bien sûr les personnes elles-mêmes qui sont toxicomanes, qui ont leur santé endommagée, mais aussi les populations autour. Et une des leçons du jour, c'est clairement qu'au lieu de diviser par des tactiques de répression et de violence, il faut rassembler. Comme l'a dit Ruud Dreyfus, il faut connect pieces. Il faut mettre le puzzle ensemble pour que ce ne soit pas un puzzle qui s'auto-agresse, mais qui se réconcilie. Comme l'a dit l'ont des différents collègues, c'est un travail qui est long, qui est ardu, c'est de rassembler tous les acteurs, de faire la concertation, de l'explication avec les populations. Même dans une ville riche comme Genève, on a des quartiers où les gens n'en peuvent plus des effets induits du trafic et ont d'abord des réactions très négatives. Il faut que ça disparaisse, il faut que ça aille ailleurs. Évidemment, ce n'est pas si simple. Donc c'est un travail de terrain et j'ai beaucoup aimé évidemment ce qu'a dit le collègue d'Ithaca. Some people have power, a lot of power and little responsibilities, and some others have a lot of responsibilities and not enough power. Ce qui est d'ailleurs un élément très classique de la relation entre les municipalités et les gouvernements nationaux. Les municipalités ont beaucoup de responsabilités et peu de pouvoir légal, et les gouvernements nationaux ont beaucoup de pouvoir légal, mais sont trop loin du terrain pour comprendre qu'il faut agir avec nuance, avec raison, avec patience, des ressources bien sûr, et de penser qu'à long terme, on économise de l'argent plutôt qu'on en dépense si on investit dans des politiques intelligentes et inclusives. C'est un travail intense, mais qui vaut la peine. Il y a beaucoup de... D'ailleurs, les municipalités sont souvent très innovantes. Elles font un travail des projets pilotes, mais tôt ou tard, on a besoin de dépasser la notion de projet pilote, parce que c'est bien, c'est intéressant, mais c'est parfois aussi un alibi pour certains gouvernements de faire semblant de faire quelque chose. En 2-3 on vient d'entendre le cas français. Mais si on n'extrapole pas ensuite des leçons qui ont un impact sur les lois, sur les règles du jeu, sur l'ensemble des dispositifs de politique publique multiples, santé publique, travail social, travail de sécurité bien sûr aussi, il y a parfois un travail de police à faire, ben, ça peut devenir un alibi tout à fait frustrant. Donc un très très grand merci pour ces échanges. Nous, les villes, on a besoin effectivement, et je me réjouis beaucoup que la commission globale ait pris contact avec nous, parce qu'on a dit, on est au front, on est vraiment littéralement au front de la réalité de tous les jours, et on a besoin d'expertise et de conseils et justement de plateformes de ce genre pour pouvoir apprendre mutuellement, parce que je crois comme vous toutes et tous à l'intelligence collective. Donc j'aimerais beaucoup remercier, ensemble avec ma collègue de Zurich, Corinne Maur, la commission d'avoir pris cette initiative, d'être venue ici au Palais Hénard, ou se connecter virtuellement. J'aimerais remercier aussi toute l'équipe d'organisation du côté de la commission, donc Isabelle Barbosa et ses collègues, et l'équipe technique. Et du côté de la ville de Genève, Dorina Ciccio et Luca Nizzola, avec le partenariat du Geneva Cities Hub, dont je suis aussi président par ailleurs, qui justement est exactement dans cette thématique, connecter le monde urbain avec les enjeux internationaux et favoriser exactement ce qu'on a fait aujourd'hui, les échanges de bonnes idées. Un très grand merci. Et alors, on a trouvé une formule pour vous offrir un verre conforme aux règles Covid. Donc c'est un peu spécial, on va devoir être assis. Mais au moins, et c'est, je crois, le premier impératif quasiment qui a lieu dans ce palais Hénard depuis la crise Covid. Donc vous pouvez apprécier cette opportunité de prendre un verre ensemble, même si ce n'est pas encore tout à fait relax. Un très grand merci à toutes et tous et encore une belle journée.